Reserving the right to object.
Is he allowed?
One thing that one.
Is there an objection?
I object.
The objection is heard. The clerk will continue the reading.
Food supply chain and agriculture pandemic response. $4 billion, $300 million to carry out COVID-19 animal surveillance, $100 million the overtime fees, $500 million to emergency rural development grants for rural health care. Pandemic Program Administration funds, $47,500,000, funding for the USDA Office of Inspector General for oversight in COVID-19 related programs, $2,500,000 to
USDA assistance and support for socially disadvantaged farmers, ranchers, forest land owners and operators and groups, $1 billion, $10 million. Use of the Commodity Credit Corporation for commodities and associated expenses, $800 million. Supplemental Nutrition Assistance Program, $1,150 million. Additional assistance for SNAP online purchasing and technology improvements, $25 million. Additional funding for nutrition assistance programs, $1 billion, to remain available until September 30th, 2027 for the Secretary of Agriculture to provide grants to the Commonwealth of Northern Mariana Islands, Puerto Rico, and American Samoa for nutrition assistance. Commodity Supplemental Food Program, $37 million. Improvements to WIC benefits, $490 million. WIC program modernization, $390 million. Elementary and Secondary School Emergency Relief Fund, $125,804,800,000.
Emergency assistance to non-public schools, $2,750 million. Outlying areas, $850 million. Gallaudet University, and it did $19,250,000. Student administration, $91,130,000. Howard University, $35 million. National Technical Institute for the Deaf, $19,250,000. Institute for Educational Sciences, $100 million.
Program Administration, $15 million to Office of Inspector General, $5 million modification of revenue requirements for proprietary institutions of higher education, a National Endowment for the Arts, $135 million National Endowment for the Humanities, $135 million Institute of Museum and Library Services, $200 million funding for Department of Labor Worker Protection activities, $200 million, not less than $100 million shall be for the Occupational Safety and Health Administration, of which $10 million shall be for the Susan Harwood training grants, and not less than $5 million shall be for enforcement activities related to COVID-19 at high-risk workplaces, including healthcare, meat and poultry processing facilities, agricultural workplaces, and correctional facilities. $12,500,000 shall be for the Office of the Inspector General, Child Care and Development Block Grant Program, $14,990 million. Child care stabilization funding, $23,975 million. Head Start, $1 billion programs for survivors, $2 million to carry out Section 313, of which $1 million shall be allocated to support Indian communities, $49,500,000. Support culturally specific community-based organizations to provide culturally specific activities for survivors of sexual assault and domestic violence, to address emergent needs resulting from the COVID-19 public health emergency and other public health concerns, and B, support culturally specific community-based organizations that provide culturally specific activities to promote strategic partnership development and collaboration in response to the impact of COVID-19 and other public health concerns on survivors of sexual assault and domestic abuse. $198 million for assist rape crisis centers in transitioning to virtual services and meeting the emergency needs of survivors. Administrative costs, $2,500,000 for the child abuse prevention and treatment, $250 million for carrying out the program authorized under Section 201 of the Child Abuse Prevention and Treatment Act, for $100 million for carrying out the state grant program authorized under Section 106 of the Child Abuse Prevention and Treatment Act, Operation for National and Community Service and the National Service Trust, $852 million to run AmeriCorps State and National, $620 million shall be used, A, to increase the living allowances of participants in national service programs. State commissions, $20 million shall be used to make adjustments to existing as of the date of the enactment of this act, awards and awards and new and additional awards, including awards to the State Commission on National Community Service Volunteer Generation Fund, $20 million for AmeriCorps Vista, $80 million for National Senior Service Corps, $30 million administrative costs, $73 million Office of Inspector General, $9 million National Service Trust to create $148 million
funding for COVID-19 vaccine activities at the Centers for Disease Control and Prevention. $7.5 billion to remain available until expended to carry out activities to plan, prepare for, promote, distribute, administer, and monitor and track COVID-19 vaccines. Funding for vaccine confidence activities. $1 billion strengthen vaccine confidence in the United States, including its territories and possessions. 2, to provide further information and education with respect to vaccines, funding for supply chain for COVID-19 vaccines, therapeutics, and medical supplies. $6.05 billion funding for COVID-19 vaccine, therapeutic, and device activities at the Food and Drug Administration. $500 million in funding for COVID-19 testing, contact tracing, and mitigation activities. $47.8 billion to funding for SARS-CoV-2 genomic sequencing and surveillance. $1.75 billion funding for global health. $750 million funding for data modernization and forecasting center. $500 million funding for public health workforce. $7.66 billion funding for medical reserve corps. $100 million to funding for community health centers and community care. $7.6 billion not less than $20 million shall be grants or contracts to Papa'ololakahi and to qualified entities under Section 4 and 6 of the Native Hawaiian Health Improvement Act, funding for National Health Service Corps. $800 million, $100 million shall be made available for providing primary health services through the grants to states under Section 338IA of the Public Health Service Act, funding for Nurse Corps, and $200 million funding for the teaching health centers that operate graduate medical education. $330 million funding for family planning. $50 million to funding for block grants for community mental health services. $1.5 billion funding for block grants for prevention and treatment of substance abuse. $1.5 billion
funding for mental health and substance use disorder training for healthcare professionals, paraprofessionals, and public safety officers. $80 million. Funding for education and awareness campaign encouraging healthy work conditions and use of mental health and substance use disorder services by healthcare professionals. $20 million. Funding for grants for healthcare providers to promote mental health among their health professional workforce. $40 million. Funding for community-based funding for local substance use disorder services. $30 million. Funding for community-based funding for local behavioral health needs. $50 million. Funding for the National Child Traumatic Stress Network. $10 million. Funding for Project Aware. $30 million. Funding for youth suicide prevention. $20 million. Funding for behavioral health workforce education and training, $100 million. Funding for pediatric mental health care access, $80 million. Funding for expansion grants for certified community behavioral health clinics, $420 million. Railroad Retirement Board and Office of the Inspector General funding, $27,975,000 to remain available until expended for the Railroad Retirement Board to prevent, prepare for, and respond to coronavirus, of which A, $6,800,000 shall be available for additional hiring and overtime bonuses as needed to administer the Railroad Unemployment Insurance Act, and B, $21,175,000 shall be to supplement, not supplant, existing resources devoted to operations and improvements for the information technology investment initiatives of the Railroad Retirement Board, and $500,000 to remain available until expended for the Railroad Retirement Board Office of Inspector General for audit, investigatory, and review activities, and funding for LIHEAP, $4.5 billion, funding for Water Assistance Program, $500 million, supporting older Americans and their families, $1.434 billion to remain available until expended to carry out the Older Americans Act of 1965. National Technical Assistance Center on Grand Families and Kinship Families, $10 million. COVID-19 Emergency Medical Supplies Enhancement.
$10 billion, $21 billion, $550 million to remain available until September 30, 2027 for making of payments to eligible guarantees under this section. The Secretary shall reserve A, $305 million for making payments under this section to the Commonwealth of Puerto Rico, the United States Virgin Islands, Guam, Commonwealth of the Northern Mariana Islands and America Samoa. $30 million for costs of the Secretary for the administration of emergency rental assistance programs and technical assistance to recipients of any grants made by the Secretary to provide financial and other assistance to renters. $3 million for administrative expenses of the Inspector General. $2.5 billion for payments to high-need grantees, emergency housing vouchers. $5 billion technical assistance and other costs. $20 million of the amounts made available under this section for the cost to the Secretary of administering and overseeing the implementation of this section of the Housing Choice Voucher Program. $10 million without competition to make new awards or increase prior awards to existing technical assistance providers to provide an immediate increase in capacity building and technical assistance to public housing agencies. Emergency assistance for rural housing. $100 million housing counseling. $100 million homelessness assistance and supportive services program. $5 billion technical assistance. Up to $25 million of the amounts made available under this section shall be used without competition to make new awards or increasing prior awards to existing technical assistance providers. Other costs, up to $50 million of the amounts made available under this section shall be used for the administrative cost to oversee and administer implementation of this section of the Home Program Homeowner Assistance Fund. $9.961 billion.
Administration, $40 million to administer and oversee the fund and to provide technical assistance to eligible entities for the creation and implementation of state and tribal programs to administer assistance from the fund, the Inspector General of the Department of the Treasury, an amount to not to exceed $2.6 million for oversight of the program under this section. Each state of the United States, the District of Columbia, and the Commonwealth of Puerto Rico shall receive no less than $50 million, $30 million to be dispersed to Guam, American Samoa, the United States Virgin Islands, and the Commonwealth of Northern Mariana Islands. Relief measures for Section 502 and 504 direct loan borrowers. $39 million fair housing activities. $20 million state small business credit initiative. Separate allocation for tribal governments. $500 million appropriation. $10 billion to remain available until expended to provide support to small businesses responding to and recovering from the economic effects of the COVID-19 pandemic. Ensure business enterprises owned and controlled by the socially economic disadvantaged individuals have access to credit and investments, provide technical assistance to help small businesses applying for various support programs and to pay reasonable costs of administering such initiative. The additional allocations to support business enterprises owned and controlled by socially and economically disadvantaged individuals, $1.5 billion. Incentive allocations to support business enterprises owned and controlled by socially and economically disadvantaged individuals, $1 billion. Additional allocations to support very small businesses, $500 million to technical assistance, $500 million Federal Transit Administration grants, $30,461,355,534 urbanized area formula grant, $26,086,580,227 formula grants for the enhanced mobility of seniors and individuals with disabilities. $50 million formula grants for rural areas. $317,214,013.
Capital investments, $1.425 billion shall be for grants administered under subsections D and E of Section 5309 of Title 49 United States Code, and $250 million shall be for grants administered under subsection H of Section 5309 of Title 49 United States Code. Services, $100 million shall be available for grants to recipients for bus operators that partner with recipients or subrecipients of funds under Section 5311F planning. $25 million shall be for grants to recipients eligible under Section 5307 of Title 49 United States Code for the planning of public transportation associated with the restoration of services as the coronavirus public health emergency concludes. Recipients and subrecipients requiring additional assistance. $2,207,561,294 as a result of COVID-19 require additional assistance for costs related to operations, personnel, cleaning and sanitation, combating the spread of pathogens on transit systems, and debt service payments incurred to maintain operations and avoid layoffs and furloughs. Emergency Federal Employees Leave Fund. $570 million, which funding for the Government Accountability Office. $77 million, Pandemic Response Accountability Committee funding availability. $40 million funding for the White House, $12,800,000 Federal Emergency Management Agency appropriation, $50 billion funeral assistance, emergency food and shelter program funding, $400 million to humanitarian relief, $110 million cybersecurity and infrastructure Security Agency. $650 million appropriation for the United States Digital Service. $200 million appropriation for the Technology Modernization Fund. $1 billion appropriation for the Federal Citizen Services Fund. $150 million AFG and the SAFER program funding. $300 million, of which $100 million shall be for assistance to firefighters grants, and $200 million shall be for staffing for adequate fire and emergency response grants, and emergency management performance grant funding. $100 million modifications to Paycheck Protection Program.
Commitment, authority, and appropriation, $7,250 million to remain available until expended for carrying out this section. Targeted EIDL advance, $15 billion, which the administrator shall use A, $10 billion to make payments to covered entities that have not received the full amounts to which the covered entities are entitled under Section 331 of the Economic Aid to Hard-Hit Small Businesses, Nonprofits, and Venues Act, Title III of Division N of Public Law 116-260. $5 billion to make payments under Section 1110E of the CARES Act, support for restaurants. Restaurant Revitalization Fund, $25 billion. $5 billion shall be made available to eligible entities with gross receipts during 2019 of not more than $500,000. $20 billion shall be available to the administrator to award grants under subsection C in an equitable manner to eligible entities of different sizes based on annual gross receipts. Our Community Navigator Pilot Program, $100 million. Outreach and education, $75 million. Shuttered venue operators, $1,250 million.
Direct appropriations, $840 million for administrative expenses, including to prevent, prepare for, and respond to the COVID-19 pandemic domestically or internationally, including administrative expenses related to subparagraphs 36 and 37 of Section 7A of the Small Business Act, Section 324 of the Economic Aid to Hard-Hit Small Businesses, Nonprofits, and Venues Act, $460 million to carry out the Disaster Loan Program. Inspector General, $25 million economic adjustment assistance, $3 billion funding for pollution and disparate impacts of the COVID-19 pandemic, $100 million. $50 million shall be for grants, contracts, and other agency activities that identify and address disproportionate environmental or public health harms and risks in minority populations or low-income populations under A, Section 103B of the Clean Air Act. $50 million shall be for grants and activities authorized under subsections A through C of Section 103 of the Clean Air Act. United States Fish and Wildlife Service, inspection, interdiction, and research related to certain species in COVID-19, and $95 million. $20 million shall be for wildlife inspections, interdictions, investigations, and related activities and for efforts to address wildlife trafficking. $30 million shall be for the care of captive species listed under the Endangered Species Act of 1973 and for the care of rescued and confiscated wildlife and for the care of federal trust species and facilities experiencing lost revenues due to COVID-19. $45 million shall be for research and extension activities to strengthen early detection, rapid response, and science-based management to address wildlife disease outbreaks before they become pandemics, and strengthen capacity for wildlife health monitoring to enhance early detection of diseases that have the capacity to jump the species barrier and pose a risk in the United States, including the development of a national wildlife disease database. The Lacey Act provisions, $10 million. Grants to the National Railroad Passenger Corporation, $970,388,160. National Network Appropriation, and $729,611,840 due relief for airports. $8 billion, not more than $800 million, shall be made available for sponsors of primary airports to provide relief from rent and minimum annual guarantees to airport concessions, of which at least $640 million shall be made available to provide relief to eligible small airport concessions, and of which at least $160 million shall be available to provide relief to eligible large airport concessions. Emergency FAA Employee Leave Fund, $9 million. Emergency TSA Employee Leave Fund, $13 million.
Payroll Support Program, $3 billion. Air Transportation Payroll Support Program Extension. Funding for Consumer Product Safety Fund to protect consumers from potentially dangerous products related to COVID-19. $50 million. Funding for E-rate support for emergency educational connections and devices. Emergency Connectivity Fund, $7,171 million to remain available. Provision of support under the covered regulations. The Commission to adopt and the Commission and the Universal Service Administrative Company to administer the covered regulations. $1 million to remain available until September 30th, 2030 for the Inspector General of the Commission to conduct oversight of support provided under the covered regulations. Funding for Department of Commerce Inspector General, $3 million. Federal Trade Commission funding for COVID-19 related work, $30,400,000 $4,400,000 to process and monitor consumer complaints received into the Consumer Sentinel Network, including increased complaints received regarding unfair or deceptive acts or practices related to COVID-19. $2 million for consumer-related education, including in connection with fair or deceptive active practices related to COVID-19. $24 million to fund full-time employees of the Federal Trade Commission to address unfair or deceptive acts or practices, including those related to COVID-19.
National Institutes of Standards and Technology, $150 million. National Science Foundation, $600 million. Support for the Corporation for Public Broadcast, $175 million funding for claims and appeals processing, $272 million funding availability for medical care and health needs, $14,482 million funding for supply chain modernization, $100 million funding for state homes, $500 million to remain available until the expended for allocation under Sections 8131 through 8137 of Title 38 United States Code, $250 million to remain available until September 30th, 2022 for a one-time only obligation and expenditure to existing state extended care facilities for veterans in proportion to each state's share of total resident capacity in such facilities as the date of the enactment of this act, where shall such capacity includes only veterans on whose behalf the department pays a per diem payment pursuant to Section 1741 or 1745 of Title 38. Funding for the Department of Veterans Affairs Office of Inspector General, and $10 million to COVID-19 Veteran Rapid Retraining Assistance Program. $386 million, prohibition on co-payments and cost sharing for veterans during emergency relating to COVID-19. $1 billion, Emergency Department of Veterans Affairs Employee Leave Fund. $80 million, which
Department of Labor funding for timely, accurate, and equitable payment, $8 million. Funding for fraud prevention, equitable access, and timely payment to eligible workers, $2 billion. Emergency assistance to families through home visiting programs, $150 million. Pandemic emergency assistance, $1 billion, $2 million for administrative expenses and the provision of technical assistance to states and Indian tribes with respect to the use of funds provided under the subsection. Additional funding for aging and disability services programs, $276 million, providing for infection control support to skilled nursing facilities through contracts with quality improvement organizations, $200 million. Funding for strike teams for resident and employee safety in skilled nursing facilities, $250 million.
For the COBRA continuation, $10 million.
The Secretary of the Treasury shall pay to each possession of the United States $500,000, $10 million in the case of Puerto Rico. $1,464,500,000 to remain available until September 30th, 2023 for necessary expenses for the Internal Revenue Service, for the administration of the advance payments, the provision of taxpayer assistance, and the furtherance of integrated, modernized, and secure Internal Revenue Service systems, of which up to $20 million is available for premium pay for services related to the development of information technology as determined by the Commissioner of the Internal Revenue, $7 million to remain available until September 30th, 2022 for necessary expenses for the Bureau of the Fiscal Service to carry out the section, $8 million to remain available until September 30th, 2023 for the Treasury Inspector General for Tax Administration for the purposes of overseeing activities related to the administration of this section, child tax credit.
appropriations to carry out advance payments, $397,200,000 to remain available until September 30th, 2022 for necessary expenses for the Internal Revenue Service to carry out this section.
Child Care Assistance A, $3,047 million.
Funding for state planning grant, $15 million. Funding for state strike teams, $250 million.
On coronavirus state and local fiscal recovery funds, $219,800,000,000, $50 million to remain available until expended for the cost of the Secretary for administration of the funds established under this title. The Secretary shall reserve $4,500,000,000 of the amount appropriated under subsection A1 to make payments to the territories. The Secretary shall reserve $20 billion of the amount appropriated under subsection A1 to make payments to tribal governments. $1 billion shall be allocated by the Secretary equally among each of the tribal governments, and $19 billion shall be allocated by the Secretary to the tribal governments in a matter determined by the Secretary. The Secretary shall reserve $195,300,000,000 of the amount appropriated under subsection A1 to make payments to each of the 50 states and the District of Columbia. $25,500,000,000 of such amounts shall be allocated by the Secretary equally among each of the 50 states and the District of Columbia. $1,250,000,000 less than the amount allocated for the District of Columbia pursuant to Section 601C6 shall be allocated by the Secretary as an additional amount to the District of Columbia.
Coronavirus Capital Projects Fund, $10 billion. The Secretary shall pay $100 million to each state. The Secretary shall pay $100 million to the Commonwealth of Puerto Rico, $100 million to the District of Columbia. The Secretary shall pay $100 million of such amount in equal shares to the United States Virgin Islands, Guam, American Samoa, the Commonwealth of the Northern Mariana Islands, the Republic of the Marshall Islands, the Federated States of Micronesia, and the Republic of Palau. The Secretary shall pay $100 million of such amount to tribal governments and the state of Hawaii. Not less than $50,000 shall be paid to each tribal government. Not less than $50,000 shall be paid to the state of Hawaii for the exclusive use of the Department of Hawaiian Homelands and the Native Hawaiian education programs to assist Native Hawaiians. Funding for providers relating to COVID-19, $8.5 billion.
On Department of State Operation, $204 million. United States Agency for International Development Operations, $41 million. Global Response, $8.675 billion. $905 million to be made available to the United States Agency for International Development for global health activities to prevent, prepare for, and respond to coronavirus, which shall include a contribution to a multilateral vaccine development partnership to support epidemic preparedness. $3.75 billion to be made available to the Department of State to support programs for the prevention, treatment, and control of HIV/AIDS in order to prevent, prepare for, and respond to coronavirus, of which not less than $3.5 billion shall be for a United States contribution to the Global Fund to fight AIDS, tuberculosis, and malaria. $3.09 billion to be made available to the United States Agency for International Development to prevent, prepare for, and respond to coronavirus, which shall include support for international disaster relief, rehabilitation, and reconstruction, for health activities, and to meet emergency food security needs. $930 million to be made available to prevent, prepare for, and respond to coronavirus, which shall include activities to address economic and stabilization requirements resulting from such virus. Humanitarian response. $500 million multilateral assistance. $580 million Indian Health Services. $6.094 billion. $5.484 billion shall be for carrying out the Act of August 5th, 1954, $2 billion shall be for lost reimbursements in accordance with Section 207 of the Indian Health Care Improvement Act. $500 million shall be for the provision of additional health care services, services provided through the Purchase Referred Care Program and other related activities. $140 million shall be for information, technology, telehealth, infrastructure, and the Indian Health Service electronic health records system. $84 million shall be for maintaining operations of the Urban Indian Health Program. $600 million shall be for necessary expenses to plan, prepare for, promote, distribute, administer, and track COVID-19 vaccines. $1.5 billion shall be for necessary expenses to detect, diagnose, trace, and monitor COVID-19 infections, activities necessary to mitigate the spread of COVID-19, supplies necessary for such activities. $240 million shall be for necessary expenses to establish, expand, and sustain a public health workforce to prevent, prepare for, and respond to COVID-19. $420 million shall be for necessary expenses related to mental health and substance use prevention and treatment services. $600 million shall be for the lease, purchase, construction, alteration, renovation, or equipping of health facilities to respond to COVID-19. $10 million shall be for carrying out Section 7 of the Act of August 5th, 1954, Bureau of Indian Affairs. $900 million, $100 million shall be for tribal housing improvements. $772,000 and $500,000 shall be for tribal government services, public safety and justice, social services, child welfare assistance, and for other related expenses. $7,500,000 shall be for related federal administrative costs and oversight. $20 million shall be to provide and deliver potable water. Housing assistance and supportive services programs for Native Americans. $750 million. $455 million shall be available for the Native American Housing Block Grants and Native Hawaiian Housing Block Grant programs. $450 million shall be for grants under Title I of NAHASDA. $5 million shall be for grants under Title VIII of NAHASDA. Unobligated amounts. Indian Community Development Block Grants. $280 million, technical assistance. $10 million shall be used to make new awards, to increase prior awards to existing technical assistance providers. $5 million shall be used for administrative costs to oversee and administer the implementation of this section and pay for associate information technologies, financial reporting, and other costs. COVID-19 response resources for the preservation and maintenance of Native American languages. $20 million to Bureau of Indian Education. $850 million, American Indian, Native Hawaiian, and Alaska Native Education. $190 million, $20 million shall be for awards for tribal education agencies for activities authorized under Section 6121C of the Elementary and Secondary Education Act of 1965. $85 million shall be awards to entities eligible to receive grants under Section 6205A1 of the Elementary and Secondary Education Act of 1965. $85 million shall be for awards to entities eligible to receive grants under Section 6304A1 of the Elementary and Secondary Education Act of 1965.